Hello, today I'm going to talk about dengue. Dengue is the most common and important mosquito-borne viral illness in humans. It is transmitted by female mosquitoes of the genus Aedes. WHO has ranked dengue as one of the top 10 threats to global health, as now almost half of the world's population is living in an area which is exposed to dengue virus. Almost 1 out of 500 dengue patients die in India, and so it can be life-threatening also. Many cases of dengue infection go unrecognized due to absent or minimal symptoms. Incubation period is 4 to 7 days. Incubation period means the gap, the interval between mosquito bite and the first symptoms of dengue. Dengue symptoms once started usually last for 2 to 7 days. Symptoms are fever, which is high grade and continuous. Continuous means if patient takes paracetamol, fever subsides by 2 degrees, and then again within 4-5 hours patient gets the fever. There is also very bad headache and pain behind the eyes, especially on looking sideways. There could be severe body pain, especially in the lower back, arms, and legs, and that's why it is also called breakbone fever. Even with paracetamol, some patients don't find any relief in the pain, but we can't give them any strong painkillers for fever or pain. There could be knee and shoulder joint pain and nausea and vomiting. There are two types of rash found in dengue. One is which happens on the day 1 or 2. It is red and generalized face, neck, especially on the face, neck, and chest. There could be altered taste sensation, loss of appetite, sore throat, mild bleeding manifestations, and facial flushing. Facial flushing is very specific for dengue. Recovery is usually complete but slow with fatigue and exhaustion, which often persists after the fever has subsided for up to 2 weeks. A small percentage of persons who have previously been infected by one dengue serotype develop bleeding and shock upon the infection with another dengue serotype. Dengue has four serotypes, type 1, 2, 3, 4. So if someone had infection with suppose type 2, then if he gets again dengue infection with either 1, 3 or 4, he or she may get into severe dengue. Earlier, severe dengue was also known as dengue hemorrhagic fever and dengue shock. Diagnosis is by the blood test within the first week of illness. It includes dengue NS1 antigen, IgM antidengue virus, and IgG. NS1 comes positive from the day 1 of illness and it may remain positive up to 12 days after fever onset. The other test, once it is diagnosed as dengue, some other tests which are done are CBC, urine routine, and liver function test. And depending on the patient's profile, if suppose he is also having diabetes, high blood pressure, or some other problem, other tests may also be repeated like blood sugar, serum electrolytes, and kidney function test. CBC is repeated on daily basis because there are three parameters: hematocrit, WBC count, and platelet count, which vary on daily basis, and they indicate some variations in them indicate whether dengue is going to be a severe dengue. Urine is done uh, to rule out any bleeding in the urine. Liver function tests. Uh, Most of the dengue patients have increased SGPT and SGOT, but it usually subsides. I mean, it comes back to normal once infection subsides. Some patients' SGOT, SGPT could be very high, like more than 1,000, and in that it is usually severe dengue. In severe dengue, once a patient becomes a case of severe dengue, then the doctor may also ask for a coagulation panel test, arterial blood gas, chest X-ray, sonography, and CT scan of brain. Dengue fever is typically a self-limited disease with a mortality of less than 1% when detected early and with access to proper medical care. It is a viral infection, so there is no specific antiviral treatment for this, and no antibiotic should be taken in the dengue. When treated, severe dengue has a mortality rate of only 2 to 5%, but if it is not treated at proper time, then the mortality rate is as high as 20%. Normal other things, since there is no antiviral treatment for dengue, the treatment is only symptomatic. Since there is a lot of dehydration because of loss of uh, liquid from the blood vessels which goes into the tissues, so there is dehydration. So a lot of oral dehydration therapy, ORS, electrol, etc. And for fever, when as and when fever patient gets the fever, he has to take paracetamol. That is acetaminophen. Other painkillers like non-steroidal anti-inflammatory drugs, aspirin, and corticosteroids should be avoided because they increase the chances of bleeding. Now, there are some patients of ischemic heart disease, I mean heart problem, who are already on aspirin, that is ecosprin, and therefore there is a doubt whether to stop it, continue it. So they must consult their doctor, and if their platelet count starts falling below the normal level, their ecosprin might be stopped. But once they recover from the dengue infection and their platelet count comes back to normal, they must start ecosprin, otherwise they may develop again some blockages in their heart vessels. There is no specific diet for dengue, but since, as for any other infection, we should have a very light diet which is easy to digest and lot of liquids. Bed rest is recommended for patients with symptomatic dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Warning signs are, so it can be divided into three categories. First is hemorrhagic, that is bleeding symptoms, and symptoms of impending shock. So shock has not happened yet, but patient may soon go into the shock. And the thirds are symptoms related to shock. So bleeding symptoms are bleeding from the sites of trauma, any bleeding within the stomach or in the intestine, bleeding in urine. There could be severe abdominal pain, persistent vomiting that may also contain blood if there is bleeding in the stomach. There could be seizures, that is fit in children. There are symptoms of impending shock, that is very severe abdominal pain along with restlessness, altered mental status, cold clammy skin, and vomiting. And if patient develops shock, he becomes totally white. So there is pallor, very fast heart rate, as well as respiratory rate, that is breathing rate. There could be dizziness, lightheadedness, decreased urine output, and a decreased level of consciousness. Any pregnant woman who develops dengue, they are at higher risk of miscarriage, low birth weight, and premature birth. The key factors which affect disease severity are patient age. So it is severe in babies and young children, pregnancy, and it also depends on the quality and extent of available medical care. It also depends on the comorbidity. So other diseases that patient is having, like diabetes and asthma, high body mass index, that if patient is overweight or obese, then there are chances of increased severity. Complications are rare, but they may happen. So it may involve the heart causing cardiomyopathy, or the brain causing seizures, encephalopathy, viral encephalitis, liver injury, depression, pneumonia, eye involvement, ear involvement, orchitis, ophoritis. Infection with one dengue serotype confers lifelong homotypic immunity to that serotype and a brief period, approximately 2 years, of partial heterotypic immunity to other serotypes. So if suppose someone has got infection with type 1, serotype 1, then they will be immune to serotype 1 infection for rest of their life. They will not get any infection with serotype 1. Several serotypes can be in circulation during an epidemic. Transmission from mosquito. So Aedes mosquitoes have adapted to human habitation very nicely, and even in small amounts of stagnant water, they can breed. And the eggs of Aedes mosquitoes withstand long periods of desiccation, that is dryness, reportedly as long as 1 year, but are killed by temperature of less than 10 degrees Celsius. Female Aedes mosquitoes are daytime feeders. So they inflict an innocuous bite usually on the back of the neck and the ankles, and they are very easily disturbed during a blood meal, and they fly away and then move on to another person to finish the meal. So not uncommon, the entire family develops an infection within a 24 to 36-hour period, presumably from the bites of a single infected mosquito. Transmission from humans. So transmission of dengue virus from human to mosquitoes. So an individual with dengue infection is capable of transmitting the virus for 4 to 5 days to a capable vector. Person can transmit the virus uh, to the mosquitoes 1 day before the onset of the febrile period itself. After an incubation period of 5 to 10 days, the infected mosquito can now transmit virus for the rest of its lifespan. The dengue can also be transmitted from person to person through the blood transfusion, and therefore dengue patient is not allowed to donate blood for at least next 6 months. Now the prevention. So we can apply N,N-diethyl-3-methylbenjamide, DEET containing mosquito repellent. This mosquito repellent does not work by killing the mosquitoes. It prevents the mosquitoes from smelling us, and so the mosquitoes don't come near us. You should wear protective clothing, preferably impregnated with permethrin insecticide. You should remain in well-screened or air-conditioned areas, which is not always possible. The use of mosquito netting is of limited benefit because Aedes are day-biting mosquitoes. They don't bite at night when you put the mosquito net. And we should try to eliminate the mosquito vector using indoor sprays. The most widely used mosquito control technique, that is spraying cities to kill adult mosquitoes, is not effective. Efforts should target the larval phase with larvicides and cleaning up larvae habitats. Breeding of vector mosquitoes can be reduced by eliminating small accumulations of stagnant water around human habitats, and this is the most important thing, and it is something which we can do at our own level. Now we will talk about the vaccine. Though this vaccine has not yet been approved in India and it is not being given to anyone in India. So, but one vaccine has been approved recently. It is by Sanofi Pasteur, named Dengvaxia, and it was approved in late 2015-2016. It is based on a weakened combination of the yellow fever virus and each of the four dengue serotypes. Both yellow fever and dengue viruses belong to the same family, that is flavivirus. Studies of the vaccine found it to be effective 66% of the time and prevented more than 80 to 90% of severe cases. It was approved by the FDA in 2019 in individuals aged 9 to 16 years who live in endemic areas, means where the dengue is prevalent throughout the year. It is approved only in individuals previously infected by any dengue virus serotype. Suppose the patient was not previously infected and he gets the vaccine. Then when he subsequently gets infected with the dengue virus, it may turn into a severe dengue. Thank you.